everyone. This is Dr. Dhanasekaran from Stanford GI. Pelvic floor disorders affects millions of women, yet the underlying causes are complex. I'm joined today by Dr. Leila Neshatian, a gastroenterologist at Stanford. She and her team are uncovering how overall muscle health influences pelvic floor strength. Thanks, Dr. Neshatian, for joining us. To start with, can you tell us what inspired this study and what questions you were hoping to answer?
Sure. Hi, everyone. Thank you for asking me to be here. And the fact is that we see a lot of patients with pelvic floor disorders in our clinic. And we have many patients who are dealing with symptoms such as fecal incontinence, constipation, fecal urgency, and rectal prolapse. And the causes of these problems are usually multifactorial, but we know that with aging, these problems will become more and more prevalent among women. And the question we had is if the loss of skeletal muscle mass, or what we know as sarcopenia, can really impact the pelvic floor disorders. And that's why these problems are becoming more prevalent among the aging women. So we wanted to know if women who have lower skeletal muscle mass are at higher risk for having a weaker pelvic floor and therefore disorders such as fecal incontinence or rectal prolapse.
That seems like a very plausible hypothesis. So how did you go about studying that?
As you may know, many of these patients will come to have physiologic testing, including MRIs and anorectal manometry. So we learned that looking at 260, over 260 of the women who had these tests, we tried to learn the skeletal muscle mass based on the SWAS muscle index from the MRIs that were done for evaluation of the anorectal disorders, and to be able to correlate the muscle mass with the function of the anal sphincter and pelvic floor. We correlated these measurements with the anorectal pressures that we are usually gathering from anorectal manometry.
Okay, so from the MRI. So what were the key findings?
So, reviewing all these women's MRIs and correlating those measurements with the anorectal manometry, we learned that many women with the anorectal disorders, almost 2/3 of our population, had evidence of sarcopenia, which is definitely much higher as compared to the general population that we are expecting. Of course, the aging women and the women who have lower BMI are more likely to have lower overall muscle mass. And we then thought about correcting and adjusting for the age and the muscle mass based on the BMI. And we learned that still patients who had lower muscle mass were more likely to have dysfunctional anal sphincter, lower functioning of the pelvic floor muscles, and more laxity of the pelvic floor in these patients were apparent as compared to the women who had normal muscle mass. So we think that losing a skeletal muscle is likely to be the cause of many of these problems in women by aging, and therefore they are at risk for developing the problems with fecal incontinence or fecal urgency and rectal prolapse in these women.
Oh, wow, okay, that's fascinating. So what do these findings mean for, say, patients in your clinic or general patient care?
So it's just reminding us that the pelvic floor disorders are not really local pelvic problems. They are more of related to the individual's muscle health and individual's health. And we identified that sarcopenia, if we could see that early on based on the routine imaging, we might be able to mitigate the problem with interventions such as improving the nutritional supplementation or resistance training or the physical therapy, and working on these aspects of overall health may be able to improve the quality of life that is also including the pelvic issues in these women and in these individuals. So of course, this needs to be tested in the future studies to further learn if we improve the muscle mass, whether these symptoms will be also improving or will become less of an issue in the aging population. But we definitely can see the direct link based on this study.
Okay, perfect. Is that part of your next research then, to try and improve muscle mass? And
Yes. So in our we have a couple of projects in the pipeline currently. One is that, as you can imagine, measuring the skeletal muscle or the psoas muscle index will require quite a lot of time in order to be able to measure the area. And so one of our immediate projects is to be able to train the AI model that can look at the MRIs and be able to automate this process so that in your future MRI reports, you will be able to get the muscle index and evidence of sarcopenia from the routine imaging. And this opportunistic evaluation of the imaging is one of the beauties of these research topics that we are looking at, because it doesn't require further testing. From the same test, you will be able to get further information. Another aspect of our work will be to really look at the interventions that we have in terms of the pelvic floor biofeedback therapy, physical therapy. How are they impacting the improvement of the symptoms? Are they related to improvement of the pelvic floor muscle function, or is that more of the overall improvement in general health? And the fact that we are a lot of counseling goes in these sessions with respect to the diet and physical activity, and if this is really local effect, or is more of a general effect.
okay, very interesting. Thank you so much for joining.
Thank you.